Hey guys, now that we've had our first week with doing some drug monographs, I'm going to show you an example one and the process that I went through to do it. So I used a couple of sites here. I started with Drugscom, and when you search for a drug, I just did Alprazolam because it's the first one. It's probably going to give you the overview. You're going to get the most information. You can use these tabs, but I like to use the professional one. Because it's going to kind of go through a lot of the information that we're asking for. It's going to give you more information than you need to know. It's geared towards pharmacists, but it's very helpful. And then I also used RX List, and RX List defaults to the professional right up here, but you can also look at consumer monographs. So I wanted to show you those. And then here's where I have filled out the template, and I did not copy and paste. And this information is 40% on the certification test. So I'm not making you do these to be mean. It's to give a study guide for you, and hopefully along with your clinical experience with your externships, you'll get to see these in practice and how they work, and answer some more questions about them practically. So the first one is Alprazolam. Some drugs are sold under multiple brand names, and most doctors are going to use the brand name because it's easier to say and spell. And that's what they're familiar with from when the drugs come out new and the drug reps come around. So you want to list as many possible US brand names as possible. You're not going to see the European or the Canadian ones, so you don't have to worry about those. The classification, you want the actual chemical classification here. So it is a benzodiazepine, and if you look here, it will tell you on this one, dosage forms, brand names, pharmacological category, benzodiazepine. Pharmacology, that tells you how it works. And then the dosage forms and strengths. So that you can find here. I'm on drugs.com and professional. It gives you this whole list. Don't copy and paste it, just give a summary here, and you don't have to differentiate between the brand and the generic, just kind of how it comes. The generic one is generally fine, but what you need to know and what you want to make sure you know is that it's available as a regular tablet in these strengths. It's available as a liquid this way. ODT stands for orally disintegrating tablet. I was just too lazy to type it all out. In these strengths, and it's available as an extended release tablet in these strengths. So what is it used for? You don't have to list all of them, but generally it's going to help calm you down. So it's a panic disorder, for anxiety, and sometimes for depression. Now, who cannot take this medication? So contraindications, you don't have to put when you find the information where it says caution, or make sure your doctor knows that you take this. Don't worry about metabolism and elimination, special populations, contraindications, there they are. So if obviously you should never take a medication you're allergic to, but if they're also allergic to any other benzodiazepines, they probably don't need to take this. If they have a certain type of glaucoma, you'll see that's real common to be listed. Not many people have this type of glaucoma. And then some other antifungal medications, this you don't have to put if it's not in the US labeling. So who cannot take it? And these I've kind of compiled from several other sources. So pregnancy is a big one, certain glaucoma, allergies, and people with a history of addiction. That's further on down. It may not be listed as a contraindication, but any pharmacist will tell you that. So how does it work? So it's going to affect, and this is probably going to be something that you're not necessarily going to be getting into the whole science of it, but it's going to work in the brain, and it's going to help calm you down. So you can be as general on that as you would like. Significant side effects. If you look on this page, there are so many. Scrolling on down to the side effects. side effects. It gives you this whole table. Oh my goodness, just go with a few of them. So if it looks like it's really, really common, as in a lot of, more than maybe 10% of people, and depending on the site you're looking at, you're going to see several things. There may be the medical terminology. When you put your significant side effects, this is going to be what put it in a way that patients are probably going to understand. So like drowsiness, well, that'll make you sleepy. Dizziness, most everybody. Impaired coordination, so you might feel dizzy, or you want to fall over, have trouble, because it affects the brain. It can cause some memory impairment. That's short term, not long term. But major drug-food interactions, so if you're taking an antifungal medication, alcohol is a huge interaction with alprazolam. Cimetidine we don't see very often, and then certain HIV medications. Legal classification. All right, there are choices here. I have given you a drop-down menu, so it requires a prescription. It's available over the counter, or it's prescription and it's a controlled substance. So Xanax, alprazolam is a controlled substance. We'll get into that more in a couple of weeks in lecture, and that'll mean more to you. But it is very important for you to know in practice if it's a controlled substance, because in Kentucky, if you haven't experienced this already, you have to get certain identifying information from the patient before you can dispense these medications. So it's important for you to alert the pharmacist or make sure you get that information when the patient's dropping it off. Alternative drugs that can be used, so this would be anything that's another drug that basically does the same thing. So sometimes you might find it on here, but you can also look up and you say, oh, it's a benzodiazepine. Do a search for other benzodiazepines. It'll give you a list. But these are just a couple. So do not put in alternative drugs the different brand names, because that's the same drug. It's the same ultimate active ingredient. So we're looking for, oh, well, my insurance doesn't cover this one. Well, maybe it'll cover this one. That's kind of what you want to look at, the alternative drugs that could be used. A lot of times insurances care a lot about that. So special patient information, what's important to know about this drug, it does have a potential for abuse and dependence. So people that have been on it for a long time, they don't need to stop taking it suddenly. That'll usually be under like warnings. I think I found it down here. Administration. There's a whole lot of drug interactions on this site. Again, don't list them all. Don't copy and paste them. There's some adverse reactions. This is a good way where it says the common ones greater than 10% of patients. But so like here where it'll put on, like where it'll say, like some of these will say like dyskinesia. What does that mean? The patient's not going to know what that means. So put it in a way that the patients might understand. So like sometimes you'll see something like xerostomia, or like here, diaphoresis. The patient's not going to know what diaphoresis means. They're going to say sweating. So put it in a way that the patient's going to understand. Warnings and precautions. These are really good to know. So look, sleep driving, you may be doing things. This is sort of like it can cause a blackout. Drug abuse, use caution. Here, if it has a boxed warning, you definitely want to note that. Other warnings. So you can also look into patient education. This is going to be real helpful in using words that the patients would understand. But I also put, this is just because it's something that I know, but it will show up on a urine drug screen. You'll be amazed at how many patients ask you this. Am I going to be a positive drug test for this? Yes, you will. And anytime you have an extended release tablet, you always want to make sure you know that they're not supposed to chew or crush it, because that takes away the whole extended release property. And again, the more you do these, the better you're going to get at them, the faster you're going to get at them. I'm not trying to do this to be mean. I am hoping that it's going to help your pharmacology. And it's meant to go along with your pharmacology class. So use the information in your textbook there to continue going along with it. But I hope that helps you moving forward. And just feel free to contact me with any questions, or if you don't know what something means, ask me, ask Miss Burgess. We just want to help you. I'm not here to try to like give you a bad score, but if you come across something where you can't find any special information about a field, just put none or NA or something. So I know you at least looked for it and you tried, because if you leave it blank, I have no way of knowing. So more often than not, I'm probably going to assume that you didn't look for it and you didn't try. So give me some indication that you did look for that information. That way I can give you credit for trying. Contact me with any questions.